Hello, and welcome to this episode of Smith's Got Talent, a podcast featuring students, faculty, and alumni of the University of Maryland Robert H. Smith School of Business, discussing how they've helped solve actual business challenges and leveraged AI and other tools to bring innovative ideas to the market. I'm Kim DeGross, the Assistant Dean and Head of the Office of Career Services, the host of our program. Today, we are welcoming Marina Augoustidis, the Associate Director of the Center for Global Business. She oversees global experiential programs such as the Maryland Global Consulting Program and the Maximizing Maryland Graduate Internship Program and the Careers Crossing Borders series. In her 11 years with the center, she also leads the center's marketing and communications, grant administrations, and other externally facing programs, which means she mostly works with OCS all the time, which we're so grateful for that. We're also joined by Seuun Park, who began her venture with the University of Maryland Smith School with her master's in information systems. She currently works for Premier Health Group, and she came to them through the Maximizing Maryland program, and we're excited to have you here and learn all about that adventure today. Finally, with us is Seuun Park. She is the project lead for operations at Premier Health Group, where she oversees the day-to-day operational workflows, process improvement initiatives, and cross-functional coordination across departments. And you have played a very key role in aligning Premier Health Group with our students. So thank you very much for coming today. We really appreciate it very much. So, indeed. I'm going to start with you, Marina. Tell our audience what is the Center for Global Business, sure, and then maybe what's Maximizing Maryland. It sounds impressive.
Because it is. So the Center for Global Business is one of the centers of excellence here at the Smith School. We are the hub of global experiential learning. We're an award-winning center with our Title VI grant from the U.S. Department of Education, also an export award winner from the U.S. Department of Commerce. But we do provide experiential learning programs for students through case competitions, consulting projects, internship programs, by partnering with companies like Premier Health Group and other small and medium-sized companies to help them either scale globally or solve a business challenge.
Tell us about Maximizing Maryland.
So the Maximizing Maryland Graduate Internship Program is a program where we help streamline the process for small and medium-sized companies and give them access to a pool of talented graduate business students from the Smith School. And we give students the opportunity to intern with a small or medium-sized company in Maryland over the course of the summer. We are able to provide the company some, obviously streamlining resources in terms of working with me and helping them sort of get the lay of the land with working with students, identifying maybe appropriate students for the program, but we also provide training for the students before they start the program so they do have that additional support from the center. And then on the student side, they are getting that additional training through an adjunct faculty, and also throughout the summer that's available to them as well. And hopefully our goal is that it does create a talent pipeline for the companies. So once the students go through the program and the companies are familiar with the quality of the work that they're doing, they can bring them on as a full-time hire after graduation.
That sounds like a lot of work, but also amazing outcomes. And I think Seuun is probably one of the best examples of that. So maybe you could share with our audience a little bit about your background and how you came to be a part of the program.
So my name is Seuun, and I'm currently working as an associate administrator at the Premier Health Group. And I first joined PHG last year summer as an intern through Maximizing program and continued my internship as a co-op in fall semester, and then finally got a full-time offer from PHG. Before starting my master's program, I'm originally from Korea, and where I gained my bachelor's degree in economics. After graduation, I have 7 years of experience at a university as an administrator and a business analyst. And After I came to the United States, one of my goal was to get a internship, but it was kind of tough. So before applying for the maximizing program, I applied for 400 internships, but most of them were rejected, which was really tough and kind of discouraged for me at the time. Then one of my classmates recommended the Maximizing Maryland program, and I also got a lot of help from the career services, tailoring my resume, no exaggeration, tailoring my resume, and preparing for my interview, and I finally got a chance to work at a PhD through this program.
So, Tosin, will you tell us just a little bit about Premier Health Group as an organization?
Yes, of course. Premier Health Group is a home health care provider, mostly in Washington, D.C., and then we kind of translate our health initiatives to outside of America, actually, so a little bit more global. We try to do a little bit of work in healthcare in Africa, some work in partnerships just generally, like in Nigeria and Kenya as well. So in terms of our global initiatives, we try to provide ease of access to care, and we focus on technology to help our care delivery outcomes. And we know that just within Washington, D.C. alone, or even within whatever quadrant of the world it is, there's so much data that could help influence healthcare decisions, and we want to make sure that we're part of that change, just making sure that healthcare is accessible and also care is correct, diagnosed correctly, and is also correctly administered to every individual.
Well, I have to say, as a former medical malpractice attorney, that actually grabs my attention completely. Do you know how the concept or the company got started?
Not a lot, but I can try.
Yes.
So Premier Health's group's flagship company, Premier Health Services, was founded in 2003, started off as a staffing agency right here. It was started by Mrs. Joy Arungwa. In 2008, Premier Health Services got licensed to be a full-fledged home care agency in DC. In 2017, they applied for their pediatric home care license, therefore making us a pediatric home care provider. Also in 2018, we acquired a distressed home care company and then added that to the vertical. And in 2018 as well, applied for a pediatric home care license for that company, which is now Direct Care and Direct Care Pediatrics. Since then, we've been working on just running those organizations and trying to also partner outside of DC, which is why I said Africa, and just bring in those healthcare delivery outcomes to exactly what we want it to be. So it's been kind of a journey overall from one phase of healthcare delivery to another. Oh, and I forgot, in 2007, maybe, we got licensed to be a provider for IDD waiver services, which is intellectual and developmental disability waiver services.
What strikes me about what you're describing is why you might have had a need for some help, right, in integrating the businesses, understanding the data, analyzing the processes, and where our students would have been able to come in and help make a difference. I mean, that just sets the stage and the context for why you would need some support there to begin with. So that's amazing.
Definitely. I think just having all of that, I don't want to say in a short time, but just through time and trying to balance all of it was definitely, it was a lot of work, but it was happening. It wasn't happening as quickly and as efficiently as it could have, but it was happening. And with the additional assistance from the Smith School, it is happening way better. As of right now, we're closer to our goal of delivering those healthcare outcomes. We are better in efficiency. And like I said earlier, just making sure that the operational backbone is intact enough to hold down what's going on in the field. So that's exactly where we are. And something that Chi likes to say, considering he's not here, is that we are in the homes. So we are as close to healthcare as possible. We see what the patients do on a daily basis. We take their temperatures probably on a daily basis. So why can't we help them as though the care is for them? I think a lot of healthcare is just by the template, goes by whatever it fits. So I think just being that instrument of change to make sure that the care is person-centered, and like if it's for Tosin, it's specifically for Tosin based on Tosin's lifestyle and based on the things that Tosin needs, so that Tosin's care is best and accelerated better for Tosin.
This season, during each episode, we'll have a segment featuring the esteemed AI expert and director of the Center for Artificial Intelligence in Business at the Smith School, Balaji Padmanabhan, that highlights the role of AI on the topics discussed.
Healthcare is broken. We need to fix it. Right? How many times have we heard people say this in the last 5 years, 10 years, 15 years, 20 years, right? So this is probably the most common phrase you hear, particularly every 4 years when it's election season in the US. Now, there have been numerous attempts at quote-unquote fixing healthcare, and there are lots of big names that came, threw money at this, and we've all seen, the results, right? And so far, not much has changed, although, there have been a lot of improvements for sure, but it has not been revolutionized the way I think some of the earlier attempts seem to have promised. Can AI change this narrative? Can AI fix healthcare? Now, the initial results, in a sense, if you look at it based on the uptake, is actually tremendously promising. Physicians have adopted AI at a rate and speed unlike other technologies. Last week, we had our AI symposium where we heard from a physician who had essentially shared data with us on how extensively doctors are using platforms like Open Evidence and so on. Now, that's a positive, right? A physician and the entire providers are embracing the technology. Now, it's not just the physicians, and maybe the scarier part is that the patients are embracing it, right? So users, one of the other factoids that came out recently was, a couple of years back when AI first started, the number one use case was, editing documents, getting your text right. But right now, the number one use case is just counseling, right? Conversations, human companionship. It is real, but it's also scary. And some of these questions that people are asking are, as many of you know, health related. So patients have also become users of this. You put these two together, there's enough data out there to show that AI is making a big impact in healthcare already. But healthcare is a high-stakes domain. And when we think of high-stakes domain, the use of AI in high-stakes domain becomes something that we all have to think about carefully. Now, in the podcast, you also saw something that is quite common, which is not all uses of AI in high-stakes domains are high stakes. For instance, taking a 60-page report and condensing it, doing something that might have taken 60 minutes to 30 seconds, right? Condensing reports. These are administrative tasks that are very common in high-stakes domains that aren't by themselves high stakes, right? And AI is doing that, leading to productivity improvements. But what about the high-stakes decisions themselves, the decisions that physicians make? So here, interestingly, I'm going to leave you with more of a conundrum and a puzzle than an answer. The wisdom there is that in healthcare, at least it's going to be AI plus clinician, that it's the human, the doctor who uses AI to solve or treat or diagnose. That's the way the practitioners and the community is thinking of the use of AI. But strangely, if you look at some of the published studies that compared AI alone in certain diagnosis tasks, and these are limited studies, so please don't assume that this holds in general, but these studies compared AI alone versus AI with clinicians, right, physicians who used AI. And guess what they found, right? For some reason or the other, in those studies, AI alone, often had higher accuracy than AI with a physician. And this starts, creating questions that I think we still don't have good answers to. Our belief says AI plus humans should be better than AI alone, but the limited experiments, the limited data we are seeing in that domain is actually suggesting the opposite. My hypothesis there is that, right now the way we are thinking of AI plus human is just giving humans access to AI and saying, you figure it out. Now, most likely, that's where the problem is, right? So if you just give a physician access to an AI tool, that isn't helpful, right? What is necessary is some level of knowledge where the physician would learn when to override its recommendations and when to use its recommendations and how to interrogate it so that the physician can dive deeper into those recommendations. And that's the human in the loop design that we have to engineer, not just into healthcare, but into every domain, into every high stakes domain where human in the loop is necessary. So if someone just tells you human in the loop is the solution right now, that is an oversimplification, right? So we need to still figure out exactly how that human in the loop should be trained so that they learn to ask the right questions, so that AI in high stakes domain, so that the next time we see a study being done, we will see AI plus physician outperform AI alone, as we all hope, and I should also say expect.
That sounds like an amazing synergy here in terms of the knowledge base of the students and the need of the employer. How do you go about matching those up?
It's a good question. So initially, when I come across an employer that's interested in the program, I'll have an initial conversation with them to just understand what their needs are and what they're looking to do and the projects that they're looking for the interns to work on. And having talked with Premier Health Group initially, I think what they were looking for was really taking on a team of students to kind of develop their own workflow and project, and I mean they basically had ownership over something over the course of the summer, and so understanding what they wanted and then also looking at the pool of students who applied to the program and just kind of seeing where there might have been connections and appropriate fits. But ultimately it's up to the company in terms of who they want to hire through the program, so they're given that flexibility for sure. And
it was a rigorous process, I would say. I think Marina did put it together nicely in just saying that we had expectations of kind of building our operational workflow and just helping our operations overall. Because with healthcare, there's a lot of people in the field, but the operational backbone makes sure that the field doesn't break down. So just making sure that was intact was what we wanted. I think the rigorous part of it was Premier Health Group has a couple of verticals. So we have Premier Health Services, Direct Care Pediatrics, Premier Pediatrics. So, Seuun works for Premier Health Services as the associate administrator, but specifically just making sure that we put in mind that we wanted 2 teams of interns. So the reason for such a big pool, just to focus on the 2 adult verticals, just to make sure that both companies were kind of getting similar structure at the same time. But we also figured it would be a good idea for those 2 teams to kind of know that, hey, the other team is working in this way to promote that friendly and healthy competition, nothing too out of line. So I think that was also fun for the intern class. I would leave it up to Seuun to decide, but we thought it would be fun for the intern class. So just trying to figure out what the skill set was like to put together for what company or what vertical and what people to put together and what teams was pretty fun for us in terms of, I think Marina had sent a list of about 50. Then we had to pick down from 50 to about 16, interviewed maybe 16, ended up with maybe 8. And because of the quality of the people, we wanted to get 4 interns. And then my supervisor, Chi said, you know what, I think we're going to go for 6. There's just so much to do, so much talent. And it was very impressive, the talent coming from the Smith School, to be honest. And I guess we ended up with 8.
Wow. Okay, so you show up to work the first day. Give us a sense of what that was like and how these incredible projects came to you, and you're in this group of students, and just tell us all about it.
Yeah. So when I first joined as an intern, I expect there might be like 4 interns, but it was like 8 interns. And like Tosin said, we were separated into 2 teams, and there was kind of competition between the 2 teams. And the topics that we were given at the time was like, you can do whatever you want, but try to find the bottlenecks or the challenges within the company by yourselves and do the project. It can be like creating a new services or making some improvement of the operation side, but it can be like anything else, anything that you want. So what we are trying to do at the beginning was try to interview every department within the company, and that helped me a lot to understand what's going on within the company. And then we ended up, because there was a competition between the 2, we try our best to make a best result as much as we can. It was really fun, yeah.
And what was the actual way that your team went about working together, right? One of the most important behavioral interview questions is sort of tell us about a time when you worked on a team, and there's always great responses from that, but it sounds obviously like your team did really well. But share a little bit about that, like what was did you assign tasks or duties, or how did you break up the work?
Yeah, so what we did was like I said, we did the interview first, but what the specific questions that we have asked was like, what's the bottlenecks that you're facing, or the manual works that you're doing as the like daily basis, and we tried to figure out whether we could solve these problems with the IT solutions. So we listed up based on the like priority and whether we could solve these problems with the IT solutions, and then we listed up and then bring it back to our supervisor, which is Chichi, and try to give him like whether this is the real. We think this is important, but try to like get confirmation whether it is really helpful for you.
Did you use any particular tools to kind of come to these conclusions, or do the analysis, or make recommendations?
Yeah, absolutely. We have used a lot of tools, but especially we use the AWS, and for the database management, we use PostgreSQL. And I've got a lot of help from the classes that I have learned in the Smith School, because I have the project management classes, cloud computing, and database management, and all of those classes were really helpful while I was doing the internship.
Not only with the faculty content, but I know that at the center, your team kind of helps prepare them for being dropped into, oh, here you go, here's a project, and let's compete. So maybe you could share a little bit of the prep that you give the students before they hit the workforce.
Sure. Well, I mean, I want to say first that, I mean, the basis of our experiential learning programs is to give students the opportunity to take what they're learning in the classroom and apply it to real-world applications. So that was a great example of that. Thank you. But from the center, we provide a training that's based actually in some global business foundations. So we are the Center for Global Business, and ultimately, when we initially spoke with Premier Health Group, the goal eventually is to scale globally for Premier Health Group. So that was kind of the overall intention. And so the training is provided by an adjunct faculty member and an alum of the Smith School, and he provides a training under the provision of the Certified Global Business Professional designation. So it's actually a professional designation folks have across the country, and it's basically oversees 4 pillars, from global marketing to trade finance to supply chain logistics and global business management. So that training takes place, and then he's also available throughout the course of the summer. I would say just overall like internship sort of fundamentals, think challenges, maybe, working with your team. So there is that availability for them throughout the summer.
That is awesome. From your perspective as a company, how did you sort of see this come together with the students? I love the competitive nature of what you set up naturally, but just in terms of the workflow and how, I don't know if it was you or somebody from the company sort of worked with the teams.
I worked closely with them. I would say it was interesting seeing the dynamic of both teams, because I was directly working with them. So I would go over to one office and give the first news, watch the reaction, and right after that, go over to the next office, say the same thing, and watch opposite reaction. And it was actually interesting taking that feedback back to my supervisor and be like, hey, did you realize that group A thinks this is great, but group B is like, no, 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 no. And that was, so I think with us, and also that being our first intern class, we were like, oh, are we doing something wrong at that time? Of course, the interns probably didn't know that we're double thinking our decision, like, oh, did we do something wrong? Are we hurting group B as opposed to group A and things like that? So through, I guess, more conversation between them, we found that they wanted it that way. They preferred it that way because at some point through the internship, we decided to merge both teams so that they could bring whatever horsepower they had together, build a big, one big harmonious product that just works for the firms, like all firms. So we had asked both teams, would you like to merge? Team A says yes, team B says no. So that was pretty interesting. And then on the other part of it, there were team leads. So the team leads would then come have conversations with management and let us know, like, hey, my team really thinks we should merge and I stand for them. And the other team's like, my team really thinks we should not merge and I stand for them. And we're like in the middle, like, okay, what do we do? Which was fun. And we ended up merging the teams because the majority of the classes were more for merging the teams. And I believe that it was a good idea because after the merge, all of the interns were able to sit together in the room. They were able to see, oh, our strategy was better in this particular department's workflow, or this strategy was better. So just comparing those strategies, coming together with one, I want to say close to perfect product was really good. And then we also started executing kind of after they left, try to test it out and all of that, which definitely worked and encouraged us to extend the program into the fall and into full time.
That's what I was thinking. This was a lot of effort in a short period of time. Was there any business impact when you look back on that? It sounds like you started to implement some of the things, but give us sort of that look back and what's happened now. Yeah, the update of today.
I would say that the presence of the interns was transformative for us. We had a couple of manual workflows. We needed a bit of just understanding the bottlenecks on a larger scale. And we were also a smaller company at the time. So having that work for us as well as their skill sets coming to just help lift that pressure off a lot of the staff and things like that really did help the firm. They built a cohesive and comprehensive product that kind of takes my workflow into the next and into the next. So I would say on average, let's take, for example, an intake coordinator's job that typically would take a couple of hours just reviewing a 60-page document is now cut down to 2 minutes because that same PDF file that's about 60 pages long is analyzed by AI, and then we get to see the actual input that we need: name, date of birth, diagnosis, all of that really quickly rather than something that takes days. So our intake process is quicker, and that's just one department. That's through the firm, our processes are quicker, more efficient, and overall, we're grateful.
That is so amazing.
Right? The money, the impact, I mean, that. So how does that make you feel, right? Like coming out of this, I know you're working there now, but sort of that initial like, wow, they listened to us. Like that must be amazing for you.
Yeah. So it was really great experience for us because like actually the product that we tried to solve the problems actually solved the business problems within the company. So it was really meaningful for us as well. And actually I was the one who was opposed to merge the team.
Okay, tell us
because because it was like the teamwork within our team was really great, and we felt like it's okay for us to work within our team, but eventually we merged the team, and I think it's better to merge the teams because the goals that we were aiming for were kind of similar between the both two teams, and we have created one product that is like can be applied to the both direct care and the premier health services. So that is more efficient. Yeah.
Did anything surprise you? Something that you thought, oh, this is either an aha moment or, wow, I kind of really didn't expect that out of your summertime experience before you wound up working full time?
Yeah, something that I was unexpected for me was like the ownership that was given to the interns. Even as an intern, like we can, like I said, we can explore a lot of parts within the company, and we try to solve it by the IT solutions, which was really helpful, which was actually helpful for the company. And that summer project didn't end it by that time. It is continuing up until this moment as well, and we are improving that product that can be really helpful for the company. So yeah, this is
And you wound up with a full-time job out
yeah.
there, which is amazing, right? Sorry,
I was going to say, I
Maria.
think, no,
Yeah.
that's when I first spoke with Gigi, I think that was like the coolest part of it was that they were going to get this ownership. And so to me, that was, an experience, a unique experience that a lot of interns I don't think get.
It was something that the Premier Health Group definitely put some thought into, because we know that working with like bigger organizations or company, you might not, as an intern, have that autonomy, or even you have to work under so many layers such that your work is almost, and you probably might feel like your work is insignificant. So I think we wanted to give the opposite of that experience, just letting people know that you do have autonomy here. You do get to, we want to hear from you. You are important. Your decision's important. Whatever you think, we have a conference room that we call the think tank.
Yes,
So
good.
we sit there, we do talk about this business decision. So having the interns come in, it was more like having partners come in, people that were coming in real-time roles that we were already working on. And that kind of transitions us into how they became full-time, because with the summer internship, once that kind of ended, we figured that we could retain, evaluate, and just hold our, train, evaluate, and retain our talent, to be honest. So we figured that let's integrate them a little bit more with real roles, more people. So they got to have a little bit more autonomy starting from the fall, just getting to talk to more people in the departments, doing more of the roles. Then their evaluations was more based on their performance, and just giving them that I'll take control of their own work and their own reporting. So that kind of helped them, in my opinion, transition into full-time employees. And we also felt more comfortable with having them transition because they knew the reins. They have been there for about 3 months, 6 months. So it was great.
That's amazing transition. How did that feel for you? Like, okay, suddenly I'm being offered a full-time job from this summer project is what it sort of started out. What was that like for you?
Yeah, so it's really meaningful for me. So because as an international student, it's not just about getting an internship is hard, but also like getting a full time is even more tough, But because of the summer internship, not just I have gained some real world experience, but like getting a full time opportunity is like opening a new chapter for my career. So it's really meaningful for me.
Beautiful, beautiful. Marina, if there's a company out there listening to this thinking, wait, I want to do that. I want some of those interns. Well, how would they get a hold of you or the center to participate in the program?
The program for this summer is available now. It's on our website. The company would just enroll, really, and then from there they would have a conversation with me, and then we would take it from there. They can email me or, again, go to the website.
That's great. Thank you very much. I want to thank all of you for joining us today. This is an exciting story. It's exactly the kind of thing that the Office of Career Services and the Center for Global Business wants to see. We have bright, smart, incredible students, and we have real-world problems, issues, challenges that companies want to solve, and it's just a great match that leads to people starting awesome careers.
I have to say, like, the partnership that we've created with Premier Health Group has been amazing. They've been amazing to work with. They're starting to refer us as well to other companies, and so we're really appreciative of that. But just hearing students' stories, makes my job well worth it. And so I'm very excited for you and for the other students that have come on board at Premier Health Group. So great job.
Thank you so much. Thanks for the opportunity.
Yeah. We're grateful too. I think the partnership, like I said, has been transformative for the organization. Just having that bulk of talent come in and just having them, well, I know it was a lot of students, but the transition into real world problems was almost seamless. I think that's another thing that we did learn and we're grateful for. So big thank you to the Smith School Maximizing Business Program.
Wonderful.
Maximizing Maryland Global.
It's okay.
We all do the same thing. That's good. Contact us at the Smith School. We'll get there. Thank you all so much. And to our audience, thank you for joining us on this episode of Smith's Got Talent. And we'll see you next time. To learn more about how to hire our students that can innovate in your business, please email us at smithocs-ae@umd.edu. Again, that's smithocs-ae@umd.edu.